Hello everybody and welcome to the Tuesday edition of Video Clips, and I'll start with just a couple of announcements of upcoming things on our calendar that I'm sure you want to know about. Wednesday, October 17th, our very famous Chef Del will do his monthly Conversations with Chef, and it's about pumpkins and squash. And according to Del, nothing says fall like the squash family and all the fabulous things that you can make from squash, from cream sauces to soups and stews and fabulous casseroles. And so he's got great ideas, and of course he'll take your questions about food and cooking too. And then on Monday, October 22nd, Eating a Plant-Based Diet and Having Trouble Losing Weight is the title of this workshop, teleconference workshop. It features Chef AJ, who's one of our favorite people from Los Angeles, and some of you may know her story. She's been eating a plant-based diet for a very long time, carried 25 extra pounds that she really didn't need, and really couldn't get rid of it. And finally figured out what the problem was. And so if you're interested in knowing how Chef AJ became thinner, skinnier Chef AJ while still eating a plant-based diet, you want to get involved in this conference call because you'll get a chance to talk to her, ask her questions, and all that good stuff. So if you want information on these calls or to participate, just call our office at 614-841-7700. Okay, so this week we're going to continue with this series based on the book Anatomy of an Epidemic. Recommend that you get it. It really is readable by people who are not in the healthcare profession. Strongly recommend it. I have to say that every day that I spend on this issue, I become more convinced that our decision at Wellness Forum to focus on mental health as well as physical health has been very, very important, necessary for us to do well by both our individual clients and our employer clients. And it's just deepened my resolve. So anyway, as I mentioned last week, we're going to spend a little bit of time on bipolar disease, and then we're going to get to the part which probably has made me more infuriated than anything I've read in this book, and that is about medicating children and what we've done to our kids in this country. It's just abominable. So, bipolar disease. This won't surprise you. It's the same that we heard about depression and every other condition. Drugs have made things worse. Two brave psychiatrists actually gave a presentation about this in 2008 at the American Psychiatric Conference, but nothing was done about it, of course. In 1955, there were only 12,750 people hospitalized for bipolar disease. The incidence was 1 in 13,000 people. And at the time, when drugs were not used, the outcomes were generally pretty good. 50% of those hospitalized never had another recurrence. 80% recovered in a year, and fewer than 1% ended up having any type of long-term hospitalization or disability or anything like that. There was absolutely no reason to believe that bipolar disease was either common or that it should be treated like a chronic condition. Now, to tell you what's happened since the introduction of drugs, today 1 in 40 U.S. adults has bipolar disease. Well, I don't know if they have it, but they've been diagnosed with it. They're being treated as if they have it. There are several reasons for this, and some of them are understandable. One of them is that doctors have expanded the diagnostic criteria. Anybody agitated these days qualifies for a bipolar diagnosis. And the use of both illicit drugs, but particularly antidepressants, have contributed too. Researchers have reported the incidence of manic behavior after patients are given antidepressants for over 50 years. This is well known in the psychiatric community. In 1993, the American Psychiatric Association actually acknowledged this and said that, and this is a quote, "All antidepressant treatments may provoke manic or hypomanic episodes." So I guess it's not surprising. We increased the number of people we were giving antidepressant drugs to. And of course, we would have increased the bipolar population as a result of medicating those depressed patients. It's estimated that 60% of bipolar patients began with a diagnosis of depression and were treated for it with medication that actually brought about the diagnosis of bipolar disease. Lithium was a drug that was commonly used to treat bipolar early on, but the problem was the patients wouldn't stay on it. They actually hated it because of the side effects, which included loss of cognitive function, slowing of physical movements, and all kinds of other side effects too. But another big problem was the relapse rate was really, really high. When people stopped taking the drug, they got worse instead of better, much higher than for people who took no drugs at all. Those who stayed on the drug didn't do any better. The relapse rate for them was 40% within 2 years, and after 5 years, 60%. So people hated lithium, they hated the side effects, they tried to get off, the side effects of the withdrawal were awful, the relapse rate for people who were and were not on lithium were virtually the same. Another useless drug, that's about all we can say about it. Other drugs were no more effective. In fact, the National Institute of Mental Health actually showed, their research actually showed that, quote, and I'm going to read some of this stuff to you so you know it's in their words, not mine. The major predictor of worse outcome was antidepressant use, which about 60% of patients received. So the National Institute of Mental Health acknowledged that the drugs were the problem. The drug users were 4 times more likely to develop rapid cycling. Rapid cycling means, manic and depressive state, and twice as likely to have multiple manic and depressive episodes. Not only do the drugs not work for treating bipolar disease, they result in side effects that include high rates of functional impairment. Prior to the introduction of drugs, 85% of bipolar patients returned to work in their usual occupations. After the drugs, only 24% functioned normally. So we see this continuing trend. We look at before the drugs were introduced, when these conditions were concerning, but they certainly weren't chronic and they didn't render people disabled. And then after drugs were introduced, the numbers of people suffering increased significantly, and most of them ending up in a completely disabled state. Evidence from researchers all over the world shows that taking the drugs results in permanent mental impairment and physical diseases like diabetes, obesity, and thyroid disease. And by the way, that's one of the reasons why we decided we had to focus on mental health. Not only was this a heinous situation, people being medicated for these conditions and given drugs that make them worse instead of better, but we really can't do our job with people to help them overcome their physical diseases like diabetes and thyroid disease when they have trouble losing weight and the drugs actually induce those conditions. So that's one of the reasons why we felt that this had to be part of our program at some point in time. So today, 6 million Americans are disabled with bipolar disease, and many more are permanently harmed and marginally functional. So in 1955, 56,000 people hospitalized with anxiety and manic depression. 40 million people have these conditions today. In 2007 alone, there were 401,255 people under 65 added to the disability rolls due to a psychiatric disability. And here's what is really horrific, and it will be even more horrific when I start talking about children in Thursday's episode. The mentally ill are dying 15 to 20 years earlier than they would be expected to if they were not medicated with these drugs that produce these god-awful side effects. So I'll stop there, and on Thursday we're going to talk about medicating children, which I'm sure will make you as insane as it has made me when you hear the entire story. So as always, feel free to pass this on to anybody who you think should hear it. Once again, the book is Anatomy of an Epidemic. Get it, and make sure you're at our fall conference so you can hear Dr. Peter Bregan talk about this issue. And our medical director for our Emotional Wellness 101 program will be here too, Dr. Walter Jacobson. Have a great day.